So look, just a little bit about how we're going to run tonight. We've got about 5 sections that we want to cover, and we've got a few questions with those. So while there are some people who have asked some questions, and if the doctors that aren't talking have time, they could possibly answer those in the chat itself. I'll also try and keep an eye out and see whether we can incorporate those into the 5 sections. But let me tell you what's in them. So the first section we're going to go through, we're going to talk about getting prepared for COVID. The second section will be about what's coming next and what to expect, which we've kind of touched on a little bit. The third section is about questions to do with what happens when I'm sick. What are some of the practical self-care tips or things I can do or my family could do. And this fourth section will be about mental health and wellbeing questions, and then we'll wrap up with some demographic questions. But let's kick it off because time's ticking away. And so in the first section, this is about getting prepared for COVID. Just a question to any one of the doctors who want to answer first. We had a question about, I've heard I need to make a plan and talk with my family and friends. What does that really mean? What should we be talking about, thinking about, and what should my COVID plan be like?
I'm happy to talk on that, Richard, if you like. So I guess it is great to have the plan, but I think we need to also acknowledge that we're not actually going into a society that's shutting down. You know, we do still have our telephones, we are still in contact with people, and you know, so it's not Armageddon, but I think if you think about what you might need, were you to need to go into isolation, that's an obvious thing. Thinking about your day-to-day food supplies and any regular medications. Have a little bit of a think about who's in your network. You know, we were talking the other day as a family, and my sister-in-law's down the road. She could happily drop some stuff off at the mailbox. So just thinking about some of those practicalities of what 2 weeks at home might entail. But you know, it is not, I mean, it's isolation in as far as you're not going to be interacting face to face with people, but you will still have plenty of contact potentially. And that's going to be different for different people. But a lot of families have, you know, they'll be able to nut that out themselves. The specific supplies in terms of medical supplies, again, they're not that advanced, really. If you think about cold and flu remedies, the things you might usually use, Panadols, fluids, lozenges.
What I would say is in terms of that the COVID-19 government website is really, really good, as is the Health Navigator website, and we'll talk a little bit more about that. But on the COVID-19 website, the stuff about making a plan is really good. I know that we're thinking about our neighbours. We've got an elderly neighbour out in front of us, and we've already been in touch with him, and he's kind of hunkering down, but he knows that if he needs something brought to him from the supermarket, we're very happy to do that. And so it's trying to just get this community feel going on, reaching out to other people, finding out who the vulnerable people are who might need help, and going from there.
Okay, I've got a probably a bit more specific question. What in terms of medications? One question that's been asked here is, what should we have on hand to control COVID symptoms? And are they different to when you've got it? Yeah, so sure. Could you, yeah, thanks, Richard.
Yeah, well, look, Omicron is what we're going to be getting. And fortunately, Omicron is largely an upper respiratory tract infection. It can move lower and give pneumonias. We'll talk about that a little bit later on in terms of the danger signs to watch out for. But think of it in terms of the same kinds of medications you'd use for, say, influenza. So decongestants, symptomatic relief for your throat, honey and lemon drink, lozenges for soothing your throat. stuff for headaches and body aches, so paracetamol, ibuprofen. And we've got a lot of older people here on the group, so you've got to be really careful. Some people with ibuprofen, it's an anti-inflammatory. It can have interactions with some drugs that you might be taking for blood pressure or heart failure, or if your kidneys are getting older, you just want to be careful. Paracetamol on the whole is safer. And then make sure you've got a supply of your usual medications. If you have a respiratory condition like asthma or COPD, then you're going to be wanting to make sure you've got your inhalers there and available. That'd be the main things I think about. Anything else, Nick?
No, I think that's pretty much it, to be honest. I mean, I would say the people I know, I've got friends overseas who've had COVID and a couple who've had sick. I've had relatives of friends who've passed away, but a lot of people have commented on, hey, actually, it wasn't too different to a cold. And look, I know we're preparing for the worst, but also I think most of us on a family level have dealt with colds, influenza. You know, I've spent several days in bed shivering with fevers from influenza, and so they're not all novel and new things.
And when you say you've known people overseas who have died, now that's fortunately a lot less likely to happen with Omicron.
Much less
just to
likely. It's
reiterate.
a huge scope. Yeah.
What about an oximeter? Would you recommend that people get one of those?
There is there's good use for oximeters in judging illness for some people. For the vast majority of people who don't have other illnesses or risk factors like asthma, heart disease, diabetes, obesity, high blood pressure, they probably won't need one. But if you have other things that put you in that high risk, and we have an idea about who those patients are, and we will be keeping in touch with those patients as we get positive results, or if we get positive results, those people will benefit from having an oximeter. And we've got plans to be able to get oximeters out to people if they don't have them in that situation. So it comes into play usually towards the end of the first week of the illness for those people who are susceptible. So the response that we do have is that if you don't have an oximeter and you need one and we think it's going to be helpful, we'll help supply one to you.
And just to reiterate, just to expand on that, that's kind of the national plan. So there's been a lot of planning behind this, a lot of protocols, IT systems built, and it's about risk stratification. If everyone who's at otherwise low risk goes out and buys pulse oximeters, there's not going to be any pulse oximeters around. So it is really that risk stratification that that we're looking at, and those publicly the ones that will be given out, we will be doing that clinical assessment, and then we put a request through for the oximeter and it gets delivered. That's the plan anyway. Hopefully that's how things will go.
We're just going to move into section 2 now about this, and these are questions about what's coming next and what to expect. Just a lead-in question from the chat around that was from Deborah Jones. And she said, "Kia ora, my vax pass, including booster, runs until the 1st of June. What happens after that? More boosters? Thank you." So, yeah, which doctor wants to?
This is a slightly geeky answer, actually. The reason it runs out 1st of June is you probably downloaded it 6 months prior. So it was one of this early app things. The expiry date was just related to when you installed the app. It has nothing to do with the date of when you had the vaccination. So I hear a workaround is you uninstall the app and then reinstall it is one thing you can do. But I'm hopeful that that's a bit like the old switch the computer on and off to fix all problems. Hopefully the app will be updated to reflect when you might be due boosters. In terms of whether we're going to need further boosters, really unclear. Clearly Israel's kind of moving into 4th doses of vaccines, but the evidence isn't yet very clear how important that's going to be. New Zealand was quite late to get started with vaccinations. And so we had them not so long ago, and then we've very quickly got boosters. So if you've had a primary course and then a booster, we may well get some good lingering immunity, especially if the variant remains relatively low in terms of severity of whatever comes next, because there will be a next after Omicron. What we don't know is whether that's going to be a severe virus or a mild virus. If it's a mild virus, then probably, we're probably not going to need a booster, but time will tell. Just moving on to the vaccines, it was amazing how quickly we brought the 40 years of research into the technology, but the technology, particularly the Pfizer and the mRNA vaccines, is it's very easy to do an updated version. I won't bore you with the details, but everyone's saying, oh, we can't vaccinate our way through this forever. Not everyone. Some people are saying, well, actually, if it's really severe and it works, why not? But time will tell.
Doctors, would you like to talk us through the phases again now that we're on the eve of going into phases 2? Some of us might be confused. I'm still pretty much confused. Do we all need to understand the phases and why?
It's one of those things where actually I catch up as we go as well, to be honest with you, Mark. I think, it's helpful to catch up, but there are changes so often, and I really do feel people's confusion there. And I guess for me, there's some fairly simple things from a practical point of view from where we're standing. I think moving into phase 2, the virus is around us, not going anywhere, and numbers are going to climb reasonably quickly. So from our perspective, we're changing the way we're doing things a little bit. So there was a centralized system for managing positive cases. For us now, if we get a positive case, we, Island Bay Medical Centre, will be managing those cases of our patients. So that's actually quite liberating for us. There are some other things around the people who are sick in terms of the time frame that they need to isolate. So 10 days if you're COVID positive, and 7 days if you're a contact, is a significant change, obviously.
Yeah, it's really the move into level phase 3 that would be more of a difference, which is where at the moment in phase 2, we're still expecting to give kind of a bespoke solution to our patients. Whereas in phase 3, we're anticipating we'll be really busy, and our main focus is going to be on people who are actually sicker or at risk of becoming sicker.
I know the webinar tonight is all about formulating ideas for the community to create their own plan. In terms of the phases, would we need to adjust our plans? Certainly we've spoken about what things to get, and we'll talk more about self-care. Do either of you see that through different phases would need to change?
I guess the vaccines are effective and the boosters are effective. So it reduces your chances of getting the virus in the first place by 60 or 70%. And we do have an older audience here, and we have talked about it as a more mild disease, but it's still one that if you can avoid getting, that's better than relying on the vaccine for making it a mild infection. And so I think when it's more widespread, then it's sensible to be more careful with your social interactions, which people are doing anyway. In terms of avoiding crowded areas. I mean, people don't seem to be catching it very much in supermarkets, but going to the pub is a different thing. Where you're enclosed in a relatively small place for a long period of time. I think that would be my main take-home message. It would be a bit more isolation when the numbers are really high, and that way you may get through without catching this.
Yeah, thanks, doctors. I'll just try and, for those of you listening and throwing questions in the chat, I think Michelle's explained it. We did get some questions come through previously, so I'm just prioritizing that. But at the same time, I'll try and see which questions I could throw into our sections here. Maybe I'll just add this one more before we move on, doctors. Just a question from Annette Moffat. Should she just ring the medical centre for a testing appointment if she had a scratchy throat? And what's the availability like to do things like that?
It's good. Yeah, definitely, Annette. I think if you have respiratory symptoms, it's a good idea to get tested. And if you ring through, we have people allocated to be doing it. People are generally not having to wait too long, but you know, we can't guarantee you won't have a little bit of a wait, because it changes every day how many people are coming through, so we try and match the staff for that. But yeah, but do ring, don't just rock up, please.
Yeah. So what should I do once I have COVID and I'm attempting to just self-care? What signs and symptoms are more serious or worrying? And when should I call to go and see the doctor? What worrying signs or symptoms should I look out for?
Okay, so it's a really good question, because some people will get sick. The thing that we mainly worry about is pneumonia. And people often confuse bronchitis with pneumonias. Pneumonia is when the infection has gone past the first part of your lungs, you know, your big airways down here, and you cough, 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 it's a hacking cough, but it's gone into the part of your lungs where your lungs exchange oxygen. And that's when you start getting short of breath. So some of you may be short of breath through other conditions, but it's a worsening of shortness of breath, particularly feeling short of breath just sitting there. You know, you're finding you're panting. That's a really important sign. The other sign is that you're going along okay, maybe improved a little bit, and then suddenly you get worse. You know, so you've gone with mainly upper airway stuff, but you know, runny nose, cough, feeling a bit achy, starting to feel like you're improving, and then you start getting shivery and shaky, feeling lightheaded. That's perhaps a sign of a secondary bacterial infection, potentially pneumonia, and we want to see you. Clearly, there's emergency signs. We don't want you to get to the stage where people are noticing that you're very confused, you're falling over, you're fainting when you stand up. That's really sick. That's phone 111. That's a very quick overview, but I don't know if we can put links up on here, but I don't know how many of you know about healthnavigator.org.nz. It's a really, really good site. It was actually set up by an old classmate of mine, a fellow geek. It's really, really good. And their section on COVID and how to manage COVID has got videos about this. It's written down what I've just said, because it's difficult to remember what I've just said. So healthnavigator.org.nz, and type in their search bar COVID. You'll find really useful information there, including green, orange, red in terms of symptoms to watch out for.
Change in color of, you know, if you notice someone in the household's getting blue lips, then that's a clear sign that things are deteriorating as well. But yeah.
What about calling Healthline, or should the community just call their GP, call you too?
I used to be the medical director of Healthline, actually, a few years ago, before I was medical director of the College of GPs, which I handed over to Brian Betty just before this whole COVID pandemic. He hasn't still forgiven me for that. Yeah, phoning Healthline, they're really busy, but they've really ramped up as well. So they're a very good resource. If it's during working hours, we should be able to help out. So I guess we're the second port of call, because when it's really busy, places like healthnavigator.org and the covid19.govt.nz has got lots of information about self-care. At this stage, we've got capacity to help. and we'll always have capacity to help people with serious illness. So if you're getting sick, like properly sick, we want to know. So I don't want to scare people away, but first call, self-management. Second, I'd probably phone the surgery, and then after hours, then Health Navigator. Healthline. Nick?
I think in phase 2, the other thing is we're going to be proactive about that as well. You know, you're going to get a call from one of us shortly after you get your positive swab result, and we're going to be calling you depending on what your risk factors are. If you have risk factors daily, possibly every 2 days or 3 days through this phase 2. So a lot of you will know Fiona, nurse practitioner and former nurse manager, who at the moment is overseeing all that. So if any of you guys are getting positive swabs, we know about it straight away and we're tracking it. And so, you know, there is that continuity there. So we will be calling you and setting in place a plan for the coming 2 weeks on how to navigate that. And as Richard said, that may well change as we get a higher volume, and particularly in phase 3. But yeah.
Just a couple of questions here around how to best care for a loved one who may have COVID and who lives in the same house. What's the general time? What's the recovery time looking like?
It's a bit variable, like most illnesses. I think generally people are spending 2 weeks. I think if any of you have had a severe pneumonia or a pneumonia or influenza, you know, you can feel like you've been hit by a bus, and you can gradually crawl your way out of that in the second week. In saying that, you know, one of the young fellas we've recently been talking through things, you know, within 4 or 5 days, he was feeling quite a lot better and exercising at home. So it is case by case. And I guess we're not talking about limiting spread. We'll come back to that later. But if you're in the household with a loved one who is unwell, sometimes just being their advocate and being their sounding board can be quite helpful, and making the phone calls if you're worried as well.
Do either of you have some top tips on what the sick person's needs might be, even if they don't tell you?
I think we're all hopefully compassionate, caring people, and best thing to find out what someone's need is to ask them. You know, how are you feeling? What can I do to help? And people have different responses to that. Some people don't always kind of shout out for help, but ask them. And you know, they will be, in terms of technical things, don't let people get dehydrated. Don't, you know, make sure people have their fluids. Make sure that they're eating, because if you know, even if their appetite is down, offering food that they want is really important. If they're feeling achy and sore, saying, hey, have you had your paracetamol? It was, you know, 6 hours ago and you're feeling achy again, why don't you take it now? I don't know, tender loving care. That's what you give them, tender loving care.
I do kind of want to I'm trying to go through the chat here and trying to also get some of the other questions answered here. And I'm not sure if I've got your question here, Linka, about what measures what measures could be taken for a person living alone. There was also another question around families with two houses, and going between those 2 households. They're a bit more specific, but I don't know if you guys could, docs, if you could probably just offer some quick advice on that too.
So I guess the living alone is I guess about preparation and knowing where your links are, where your connections are if you do need to reach out for help. And there are also, you know, other agencies and people that we can help or can be brought in to help out if you need outside assistance with things like shopping or otherwise. You know, it's nice to be as prepared as possible, but if you have people you know that you can lean on, And if you don't, and you find yourself sort of caught short, there are people galvanizing in around that could come and bring shopping or bring medicines or the like. Split families, I think, is tricky. When you're talking about people with positive cases in the household, there's two dynamics at play, isn't there? There's the chances of sharing that infection across those two households, and that is pretty darn high. And then there's your own personal connection, your wish to be with your kids or your other loved ones, and their emotional needs. And navigating that's going to be different for each household, I think. But I would say if you'd have to think pretty long and hard about saying, no, I've got COVID and I really want my child to come and visit me because that's my right. I think you'd have to have some decent thoughts and communications about it, really.
Yeah, tricky one, isn't it? I must admit, I hadn't really thought of that scenario.
Yeah, right.
When even reading the advice around what home isolation means is about within your home trying as much as possible to avoid your close contact, so sleeping in a separate room if you've got a separate room. If you have to be in the same space wearing a mask and it's 2 meters apart. Now, how realistic that will be, I mean, for me, I'm a relatively affluent doctor living in Island Bay in a big house and my kids are at university. That's really easy for me. But I've got to realize that an awful lot of people in our community don't have the same advantages. And it's really going to be really difficult for some. So, I guess best efforts in terms of what we're trying to do here is this whole flatten the curve thing. Not a big, huge peak where we overwhelm the health services, which means people who are sick don't get care, but flattening it down. And it's by reducing spread or rate of spread that we stop that peak being so high. So that's kind of why we're doing it. But people are going to have to fit that into their personal circumstances. Yeah. So I think neither myself nor Nick gave a really clear answer, because I don't think there is a clear answer. It's around thinking about those principles and how you apply that into your own circumstances.
Thanks, Ox. Talking about the spaces within the household, and if you only do have one bathroom or one toilet, in terms of home sanitization, I've got a question here. If a sick person uses Dettol or something called Glen 20 to disinfect bathrooms and sinks, would that be enough? Would that be sufficient for multiple use, I guess?
Yeah, there's it's shifted a fair bit, like many things, isn't it? In terms of early on in the COVID outbreak, there was a lot of talk about surface spread, and it is still important, but it's the ventilation and the respiratory and the spaces that we share, that we breathe into, that are probably most impactful. But yes, you certainly do need to think about sterilizing surfaces, and thankfully the virus is actually quite susceptible to most detergents. So the simple hand washing with soap is effective because that soap ruptured the virus, and it doesn't survive that, as long as you give it a decent wash. So when you're thinking about surfaces in a bathroom, if you're giving it a good wipe down with pretty much most detergent products, you're going to get, if you give a reasonable coverage of that surface, you're going to manage to get rid of most, if not all, viral particles. Glen 20 is something that comes in a spray can, and I think that's a bit limited. If you think if you're wanting to contact each virus particle and you just put a spray over it, the spray is only going to land on what it lands on, and there'll be bits in between where there might be viral particles. So you really do need to think about wiping and covering those areas where they might be.
Yeah, you mentioned it, Nick, it being respiratory, or contacted through breathing. What about shower or shower and steam? And what is there a risk of transmission there, or does simple water wash away the virus particles?
Yeah, I don't know the specific answer to the effect of a steamy room, but they're orders of magnitude different size particles. Like, even though you can't see the steam in your room, it's tens and tens of thousands of times bigger than a viral particle. So these viral particles will be floating around in the room, but they actually settle pretty fast down towards the ground, and then they die reasonably quickly. We have talked about surfaces, they can linger, but on the whole, most of the viral load goes pretty quickly. So I wouldn't be worried about showers and steamy rooms. I'd just be thinking more about ventilation, really. So either have the window open while you're having a shower, but if it's a raging southerly and it's coming in too hard, then maybe just open the window after you've had your shower, just to ventilate that room.
And what about shared towels or hand towels? Are they able to transmit the virus to other family members?
Yeah. Yes, not as, like, in terms of magnitude and risk, not as much, but I think if you're going to try and limit it as much as possible, you'd be better to have different towels and face washes and soft stuff.
Okay. I'm going to just go back to Richard. You talked about flattening the curve, and Peter here has a question on chat. Is flattening the curve the best option at this stage? We are in summer. If we delay the peak till later, that might push it out to the winter, which may be more dramatic.
Yeah, I mean, we have been really fortunate in terms of timing things in when the weather's better and not having that double whammy of influenza and coronavirus. I don't think this is going to last into the winter, personally. If you look at the peak times that you're seeing, particularly in Australia, is probably the closest we have. And of the Australian states, probably Queensland and South Australia are the closest to New Zealand in terms of vaccination rates. And they were pretty highly vaxxed, and they still had quite a fast peak. That's been different around different parts of the world, but I'd say we're probably going to be at peak, my guess, educated guess, in about 3 weeks. And then in 6 weeks, I think we're going to be well past peak. And even if we're flattening the curve, I think actually the main thing we've done with flattening the curve has been high vaccination rates. I mean, New Zealand has done extraordinarily well in that regard. We're 2 or 3% higher than South Australia and Queensland. Our booster numbers are fresh and going up quite quickly. So it may be that our peaks, again, I'm always a half glass full kind of guy, but I think our peaks are going to be lower here come what may. And then I don't think it's going to be hanging around I'm kind of, I think it's going to be hanging around for months and months at a high enough level that's going to make us have to be doing a lot more of level red.
You mentioned earlier about, spoke about pneumonia, but we have a couple of questions here about pneumonia. I'll ask them both and throw it over to either of you. One question: if you have pneumonia symptoms, what should you do? Try to get to the medical centre or the hospital. And then from Kevin Presney, who said, are you more susceptible if you have already had pneumonia?
Kia ora, Kevin. Yeah, possibly, in answer to your second one, Kevin, although different organisms behave slightly differently. So yeah, I think there probably is a little bit of extra susceptibility there to be aware of, but it's by no means a guarantee that it's going to be severe. I think if you're starting to develop symptoms of pneumonia, again, we will be talking to you in this phase 2 before that happens, and we'll be in contact. But I think your first port of call will be a phone call. So it would probably be best to phone the medical centre first, and if you need more care, it's generally going to be in the hospital. But what we would do is look to facilitate that in the best way possible. So usually getting the transport to get you there straight to the specialised team that's existing to support you best. So it would be a phone call in the first instance.
And would that be the same? I mean, obviously that's the same for children too.
Yeah, I mean, this essentially the last thing the hospital wants is a whole lot of people showing up unplanned. So a lot of the planning that we've been doing has been around taking people with symptoms and making them planned transfers to the level of care that's needed. And so general practice is remaining the same as ever. We're still the first port of call. Now it's different if you have a car crash or you think you're having a heart attack, then it's 111 and straight to ED, but still try and come through us during normal working hours. And then we talked about the Healthline. And Nick, where's the after hours in with this?
After hours probably doesn't have a role in managing COVID in its respiratory sense. There is probably a role for people who have COVID who have non-COVID related symptoms. So you're isolating at home and you break your wrist, then there might be a role for after hours. But essentially, if you're from a respiratory point of view, it would be the hospital that would be your backup. Because remember, there's a lot that we'll be doing from a respiratory point of view, the COVID illness. You don't tend to fall off your perch, or pardon the slang, but you don't tend to suddenly crash. You know, we talk with our colleagues overseas, and the experiences of, you see these kind of people who have progressive symptoms, if we're talking about just COVID, over usually a number of days. And picking those things beforehand, we're aiming to have those conversations so that we can plan things before you deteriorate. It's not generally a rapid deterioration, except when you get to that sort of knife edge of things. So remembering most people won't get to that knife edge, but yeah, I would say those respiratory symptoms are a gradual and progressive onset rather than sudden.
Yeah, Nick, I think that helps answer one of the chat questions that was posed by the CCDHB LO team, and their first two questions were, if we have COVID and we need advice from the GP, this is more around charging, are we charged the usual consultation fee for every contact, and is there any charge for the SaO2? I think I've got that, machines, if you deem them necessary.
It's all funded.
Great, awesome.
Your tax dollar.
All funded if you've got COVID.
Yes.
So it's all funded if you've got COVID. If you're phoning us, and you may have noticed, if we're doing an assessment for you with respiratory symptoms and we do a nasal swab, then for COVID, which we're doing surveillance, then we get paid for that as well, and so that's why you're not being charged. But some of you may have come along and you had a swab a week ago and you hear really about your asthma, then you do get a charge if it's a standard GP consult unrelated to COVID. But everything COVID related is funded.
Okay. Doctors, I'm going to just move into the next section, which is on mental health and wellbeing. Just a couple of questions here. One was from an anonymous person. I'm quite worried and anxious, but others don't seem to be at all. Any advice? Should I be worried or go about my business as usual?
Hard to answer, isn't it? And I think we all have our different levels of worry and anxiety at different times. I've felt my own flux over the last couple of years, up and down. And so I would say it's quite normal to feel a sense of anxiety at the moment, particularly because there's a lot of messaging that we've been getting of this terrible, fearful thing, and yes, there's some truth in that, but I think that messaging is shifting, and I think, yeah, it's hard to, when there's that gap between danger, no one can tell you there's no danger, and then the fear and the anxiety of that, because they're not quite the same thing. So yeah, it's valid what you're feeling, absolutely. You know, we're not in the business of empty promises or saying everything's going to be absolutely fine, but I think for the vast majority of people it will be. Reach out and talk with the people, be real, you know, the people around you. Don't feel that you can't be real, because I think we all are, you know, we're all looking after our well-being. I know Richard's cycling miles I've seen gone up on Strava at times during the last couple of years, and I'm doing a bit more time on my bike. I drove around the bays today and thought of the, you know, those 5 elements of well-being that the New Zealand Mental Health Foundation talk about. I stopped and took notice of the dolphins that were out in the bay, you know, some of those little things that just help ground you, you know, whether it's thinking about, you know, the people around you or just taking notice. The giving that some of the people are doing here in the community, I think it's part of them being as well in themselves mentally as well. It's actually part of all of us. So all of these things have relevance to staying well.
Yeah, and that's really useful, Nick. I think exercise is known to be really helpful for reducing stress and anxiety, but also what you were saying, Nick, around there's some acceptance that, yeah, you know, it's ramping up to the sharp end of this pandemic, and we've been wondering what was going to be coming along. So if you're an anxious soul, it's normal that it's made you more so, and that's nothing to be ashamed of, and it's something to try and manage, and it's managing it through those supports that you have. There are also really useful online tools as well, says the geek, because we know that counselling services are really overrun. So and there's a multi-week waiting list for those. But again, on the Health Navigator site and the COVID-19 site, there's talk about resources, online resources for helping with mental health and anxiety. And some of those tools are really, really good.
I've got some more specific questions, which I'll just fire out. What advice do the doctors have for grandparents who pick up grandchildren from school and take them home till parents finish work in the late afternoon, especially if the popper is medically compromised?
Oh, tricky one, really tricky one in terms of it's balancing that risk, isn't it? I mean, children can get COVID. It's a bit different to usual coughs and colds and influenza, where children really are the main reservoir. That is the source. And it doesn't seem to be the case with coronavirus, well, this particular coronavirus. I think I'd go back to what I said before in terms of it's that individual risk assessment of how much of this is around. So at the moment, I would say, well, you know, wear a mask, and clearly if your grandchild's got respiratory symptoms, maybe don't see them until they've been tested, and you could be that it's not COVID, and that only takes 24 to 36 hours. But if you're particularly immunocompromised and there's a lot of COVID around, I'd probably play that one safe.
And just going to the, I guess there's another question around uni students. What advice would you give to first-time uni students going to live in the halls of residence?
Get them in a meningococcal C vaccination. Seriously, you know that if you're vaccinated and boosted, your risk is really very low of getting serious outcomes in that age group. And we really encourage people going off to halls of residence to get a meningococcal vaccination is probably more important. I mean, I'll definitely get the vaccination against COVID. That's what's protecting you. I'm fine with my kids. They're just heading back down to university at the moment. They're not in a hall of residence this year, but they're in a flat. They're going to be going to the orientation parties, and I'm comfortable about that.
Okay, just Miriam E posted in the chat just about a new book which talks about anxiety and this crazy time that we find ourselves in. It's called Finding Calm. If you didn't see that. I've just want to also just relay a message from the team at the Island Bay Community Centre, who are saying, tēnā koutou, at the Island Bay Community Centre, we are looking at ways that we might be able to support those locally who are isolating at home due to COVID, whether they are sick, close contacts, or staying at home because they are immunocompromised. If you are interested in volunteering some of your time to help out, they would also love to hear from you. This could be as simple as giving someone who is isolating a phone call, cooking someone a meal, or doing a daily online yoga session together. If you are interested in sharing your ideas or getting involved, please contact Rose and Bronwyn. And I think Michelle will put in a link into the chat there if you want to click on that straight away. Look, we've come to, we're up into the wrap-up session there, and I'm going to be thanking, well, first of all, let's thank everyone that was involved. To our two superstars of the community, our doctors here, Dr. Richard Medlicott and Dr. Nick Oscroft. Thank you for your time tonight and sharing us some of that advice around how we can prepare ourselves for what's coming. I also want to give a really special mention to the staff of the Island Bay Medical Centre and the Unichem Island Bay about the awesome work that they're doing behind the scenes. No one gets to see that, but they're certainly putting in the hard yards for all of us, ensuring that our health and well-being is looked after. I also want to thank some of the sponsors and supporters of the 3 series. This is series number 2. And of 3, Island Bay New World, Kavita's Kitchen, Wellington City Council, and just also, I mean, you wouldn't have thought that 2 days ago we were on the end of a storm here. Thanks City Council for cleaning up a lot of those slips around here in Wellington and Island Bay. I also want to thank, the Island Bay Community Centre, the Adult Community Education, and the Island Bay Enhancement Trust. Also, the 3rd series, which will be run by Ask Dr. Marion Anything, for some of those questions that I did not get to answer tonight, we will prioritise those in the 3rd series, which is on Sunday, the 20th of February at 7:30 p.m. Just a couple of more other events. There's a walk-in vaccination clinic, the last one this Saturday, which is on at the Baptist Church. Check out the Island Bay Festival website for details. And plus, we'd love your feedback and email on this. Finally, I want to just give the last 2 words over to Dr. Richard and Dr. Nick. If you two have any other things you want to say to the rest of the community while they're still on, now's the time. Kia ora, doctors.
I can see Lockie asked a question up there. Broken bones. Yep, don't worry about it. Your immune system's fine. Not working overtime. That was a cool little question. Look, lovely seeing you here. It was only about 5 minutes ago that I realised there were another 4 pages of participants. So what a great turnout. I hope you've all found it really useful. Just want to reiterate, we're here to help. We've got our systems set up. We're available. We'll help you get through this, and just stay healthy, get boosted if you're not boosted already, wear your mask, as they say, don't be a dick, and we'll get through it just fine.
Thanks, Richard. Thanks, guys. It's pretty humbling actually being a small part of the community, and we've got a role to play, but it's amazing to have this sort of thing come together. So, I just sent Michelle an email this morning saying, hey, I wonder if there might be people in the community who we might be able to call on if people need extra help. And she said, well, speak of the devil, I've just been speaking with Bronwyn and Rose and the office there. So it's a pretty cool community, and I think that's a massive asset to all of us. So thank you, guys, and we'll catch you soon. Thanks,
okay,
guys.
so for everyone, this is our sign off, but as we enter into phase 2, we want to just keep reiterating, keep getting boosted, keep getting your COVID shots, make a plan, get yourself some medications to look after yourselves, look out after other people too as well. So tēnei te mihi atu ki o koutou I tēnei wā, huri noa, tēnā koutou, kia ora mai tātou katoa. Good night, everybody.